BizTech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help you to ensure a more productive and healthy life for yourselves, your families, and your employees. Now, the conversation today is about recognizing the red flags of back pain. This presenting and content partnerships is with KPJ Ampang Putri Specialist Hospital. Now, to bring an expert lens to this topic, we have Dr. Carmel Ibrahim, orthopedic surgeon at KPJ Ampang Putri Specialist Hospital. Dr. Carmel, welcome to the show.
Thank you very much, Brian.
Now, Dr. Carmel, could we start by you giving us an overview about yourself and your training?
Okay, I'm just joining KPJ Ampang Putri early of this year, but actually my practice just started as a specialist since 2012. I'm graduated here in Kuala Lumpur under UKM, University Kebangsaan Malaysia, and further my spine studies also in UKM with certain attachment in Korea and also under AO Spine. So that is a little bit of my introductory.
Okay, so interesting. Why did you go to Korea for training? Is that a special reason why they have certain specialty treatments?
Oh, okay, at that time actually, you know, when the progress of the spine general condition and surgery, Korea is one of the advanced center which doing endoscopic spine procedure. So to know better, I need to go and see by myself how did they perform all this kind of endoscopic technique, just to enhance my technique and also my care to my patients.
Okay, and so obviously when you came back to Malaysia, you not only continue to practice, but you also were a lecturer, the teaching lecturer in the National Defence University. Am I correct?
Yes. Before this, I'm actually a lecturer at the National University in Kuala Lumpur. We call it University Kebangsaan Malaysia. And I shifted to the National Defence University under the military program. The total overall, I think about 7 to 9 years in the academic sessions.
Okay, so you've obviously have a combination of academic and also, of course, theory and practice.
Yes, I think I saw.
Now, so Dr. Carmel, what inspired you to be a doctor?
But actually, I've been brought up also in the hospital, whereas my mom actually the midwife.
I see.
So looking at the environment, actually is a bit giving me some inspiration to become a doctor and also to help other peoples. And furthermore, I'm practicing spine now because I found out that the most difficult problem to anticipate or to rule out is actually a general spine condition that's it's not easy to handle. So that's why I'm go further now towards more on the spine condition.
And you know, Doc, you are completely correct, because many of us, as we get older, because of the way we sit down, the way we spend hours on the computer, maybe we have carried something wrongly, and then we basically injure our spines to a point where it becomes a serious discomfort over many, many years. But for a start, can you share with us, how do we find out whether, for example, back pain is a muscular issue or something else?
Okay, a good start question actually. You know that most of the patients and most of the person that will experience back pain, including you and me. Okay, so I think from what I've seen, a lot of patients that come to me, how do I exclude the non-specific back pain is actually most of the symptoms and signs are self-limiting. Usually we resolve within 4 to 6 weeks, and sometimes certain of the patients require a very short term of analgesia to make them feel better. That's how that you differentiate.
So that is very interesting, because I think a lot of people are very worried about getting their back pain sorted out because they're worried about going for surgery and the dangers around it. But before we get into the more serious aspects of that, could you define maybe red flags in terms of spinal conditions, more serious conditions?
Red flag, okay? When you see the red mean alert. Okay, the red flag actually is a combination or is a group of the history taking where patient presented to you, okay, based on the, we call it the symptoms. That means you ask a question that are certain question that you can identify these are the common red flag, followed by a group of the combination of physical presentation based on your physical examination. You can find out the collection of this history and physical that together with a certain presentation, we call it the red flags. So this we need to find out during the history taking and physical examination for those who come in with the back pain presentation.
Okay, so give us an example of some of the causes of these red flags or the risk factors.
In general, actually, when we talk about the back pain, there are a lot of risk factor that can lead to back pain. For example, the age, the gender, poor general health, physical stress on the spine, and also psychological stress. Whereas there are more specific causes of the back pain that suggest emergently like trauma, okay, emergent pathology like trauma, infections, tumor or malignancy, or other inflammatory conditions. So these are the risk factor for the back pain.
Okay, and so age is one of the issues, but a lot of times we've basically, and I want to take a step back a little bit. Let's just say, for example, we've injured our spine lifting something. Now, and you said some of the things can be done with just a little bit of manipulation, anesthesia and treatment, but when is the line drawn when surgery is required?
All right. Again, I would like to highlight that when we talk about the red flag sign, okay, it doesn't mean that you require surgery all the time, but it guides you that the certain condition that require urgent attention, whether by giving a medical therapy or by doing surgical intervention. For example, when you say to me that just now you're having a back pain after lifting heavy things, which is very common presentation, as I told you earlier, it's mostly will self-limiting about 4 to 6 weeks. So the time is very important now, Brian, because within 4 to 6 weeks, we can try with the self-limitation by conservative treatment. What we call the conservative treatment is the medication plus physical therapy. So after this certain period of time, when the pain is still persists, then we will go with further investigation to identify what are the serious pathology underlying all these kind of problems.
Okay, so essentially what you're saying right now is very interesting, which is very counterintuitive to what most of us will do. What you're essentially now saying is come to get treatment as quickly as possible, get examined, because you have a 4 to 6 week window for it to be quickly, it could be very relatively simply cured without intensive intervention required.
Yes, I really agree with the answer. Actually, even though you have a back pain, maybe you can try to wait and see for a few days and take some simple painkillers. But after that, I think for me, after 1 week, you should get your doctor's advice, because as what you mentioned earlier, the time frame is very important to you to determine whether the injury later will be permanent or you can anticipate earlier.
Okay, so doctor, I want to ask you broadly from a Malaysia perspective, because you have a very wide experience in orthopedics in terms of back issues, ranging from, as you said, academic perspective, then you worked in government, then you also work now in private sector. What are the common issues that are faced with Malaysians in terms of back issues? What do most of your patients come to you with? What sort of problems?
Okay, most of the patient actually, when it comes to us, always related with can be divided into straightforward or non-straightforward condition. If you fall, if you're lifting heavy objects, or if you have any history of trauma, that is very straightforward. You can come to me and we can identify the problem earlier. But if let's say you have a constant pain on prolonged sitting, unable to sleep, and you don't really active, you don't have a history of fall, is it? So these are the common presentation, especially what I see, the patient comes to me after a long term of the work from home during the MCO. There are a lot of back pain that coming through without any history of injury.
Interesting. So essentially what's happened is because of work from home, they're all sitting at their desk. Probably their posture is not correct. They're living relatively sedentary lifestyles, and then
Yes.
they can't see you because they have a problem.
Yeah, basically, actually work from home, you take a lot of time longer than working at your office.
Interesting. See, coming from
That
a
is being
doctor.
mentioned by the patients.
So this is very interesting observation coming from a doctor. So Dr. Carmel, from a simple perspective, because this is obviously a problem that is solvable, what are things that the patients can do themselves? For people like us, someone like me who works from home, what can I do to make sure I have better back health?
Well, when you work from home, we have to admit that not all our houses are really considered ergonomic for us to do activity or works, is it? We don't have certain people don't have their own proper room or tables or chair to sit and do their works comfortably. But certain people have everything. Even they can sit on a massage chair while doing their works, correct? So
Yes.
what I can advise here actually, even though you have to work from home, to do work from home, you're going to take a lot of time to settle your work. You have to be active. You can move around after 5 to 10 minutes. You don't have to stay in front of your computer, and you must make sure your posture is very proper. Sit tight, straight the spine, and try to prevent your shoulder to be shrugged forward,
Okay.
because in sitting position with bending forward is the most highest pressure on the disc in your back and spine. So this will cause a problem as considered as a long-term effect on the problem. And you cannot actually sitting too long, more than half an hour or more than 1 hour or 2 hours, okay, because including the driving, because this can lead to the worsening of whatever pre-existing or the new condition of your lower back. So my advice is try to move around, move your leg, do some stretching after certain period of time. Maybe certain people, they're very busy, they don't really know what the time is, just set on with the alarm to alert them that, oh, I have to do some stretching. At least less than 30 seconds of stretching will lead all the muscle to be balanced.
Okay, so doctor, this is obviously a very common thing. Two scenarios, obviously. One is, could you explain to us what is a simple scenario in terms of recovering from all the stresses that we are getting from back pains as a result of working from home? Simple ways, if it's not a complicated case, and what are the treatment options if perhaps the case is a little bit more serious?
Okay, when we go to the serious condition of the spine, like red flag sign, again, I would like to highlight to you that the actually red flag sign is a presentation of a few conditions. For example, let's say you have a trauma. This is very straightforward. You have fractured spine. Okay.
Okay.
The age that I'm going to mention actually, when the presentation of back pain less than 18 years old is considered a red flag sign. And
Okay.
more than 50 years old also considered a red flag sign. A certain patient that have underlying diabetic, we call this immunocompromised condition,
Okay.
diabetic or end-stage renal failure with back pain, please come and seek the treatment earlier, because this kind of patient has a very high risk of the infection in the spine. Okay. So another thing is that people who have a features of the significant weight loss, about 10 kg within 3 months, without any, intention to do a weight loss.
Okay.
Okay. Prolonged fever or unexplained fever or night sweat, that means fever at the night time. Okay. Another symptoms that will lead to the infection or malignancy in the spine. Okay. The other presentation that I would like to highlight actually is a patient who have a weakness of the lower limb. Suddenly, he have persistent pain and weak. And the most important thing is patient have a bowel or urinary symptoms, which is actually they can't really control the urine. And suddenly they feel that the urine come out, followed by the numbness. You can feel the numbness. That means the numbness, you understand the numbness is you don't feel anything or
Yes.
changes of the sensation all around your buttock, inner thigh, and surrounding your groin. So these are the history that you need, or if you experience this kind of condition, these are the red flag sign that you need to anticipate. Okay, why I tell you this, because all this presentation actually lead to the instability of the spine, and also it indicate a serious compression of the cord or the nerve root that lead to all this presentation. So these are the things that you need to look for before you go identify the next step of management.
So with these serious cases, is surgery most of the time the only option, or what are the other treatment options?
When this kind of conditions has been identified, okay, it's considered as orthopedic emergency. Emergency in orthopedic is not always associated with surgical surgery. But what I'm going to tell you is we treat based on the conditions of the patient, based on the diagnosis. If let's say the first presentation is, as I mentioned to you earlier, that fever, loss of appetite, loss of weight, with the immunocompromised condition like diabetic, the first come into our mind actually is a tuberculosis of the spine or infection. So this kind of condition, the mainstay or the first treatment is always medical therapy like antibiotic, a few groups of antibiotics. Whereas the presentation that I told you later regarding the numbness, weakness, urinary disturbance, okay, and the saddle anesthesia, we call it cauda equina syndrome or conus medullaris syndrome, actually is diagnosed based on the level of the spine anatomy. This kind of condition may be due to the chronic severe compression of the disc of the nerve, can be either severe lumbar disc prolapse, which require urgent surgical decompression.
Okay.
So again, it depends on the condition itself.
Depends on the condition. So then from a post-treatment perspective, what sort of management therapies that the patients need to do or do together with the hospital and the doctor in order to prevent some of these things from reoccurring?
Okay, in general, if let's say patient have a lumbar disc prolapse or huge disc that cause cauda equina syndrome, after you do a surgery, decompression, he has to maintain his body strength in order to prevent the things to be recur. For example, that is for example of the cauda equina syndrome. Whereas in the diabetic patient or immunocompromised like end-stage renal failure, after we do the surgery with antibiotic for the infection, they have to taking care of their own diabetic control to avoid the thing to be recur again. So again, the post-operative care basically depend on what kind of the diseases and what kind of treatment has been given to the patient.
And Doc, this basically stems to a couple of key things, mainly related to lifestyle, isn't it? So when you have diabetes as a core, there's so many different aspects of complications that affect your health overall.
Right.
The other thing also then, from what I hear from you, is really around lifestyle. A sedentary lifestyle without exercise is one of the reasons why we have back issues.
Right.
Now, is, for example, one of the ways, and we've heard this before as an urban myth, and I want to ask you whether this is correct or not. A lot of times I've heard this where people say, oh, if you have problems with your back, swimming is one of the exercises that really helps you from an overall muscle condition perspective. Is that true?
In general, actually, swimming, because it's considered as a non-gravity activity, that means it doesn't put pressure on your spine. That's why people say that the swimming can improve your muscle balance without hurting your back. So that is really true. The other thing that you can do actually is cycling. in certain people who have a spinal cord compression, which is cannot walk very long time or certain duration, like less than 10 minutes, the cycling actually can help to improve the nerve, to blood supply to the nerve. And I don't say that you can't jogging or you can't running because of you having back pain, because there are certain maneuver or types exercise that can allow you to go back to your activity. You must have a proper good shoes in order to prevent further stress on the spine. So that's actually the idea of the aim of the anything that we do is to let the people or patients go back to their pre-existing condition or activity. We doesn't want that after the surgery, everybody stay at home and sit on a wheelchair, correct?
Yes, absolutely. You know, and we always have to think about how we can get back to our best. Now, Dr. Carmel, it's been a fascinating conversation, and thank you for educating us around the back pain and the red flags of back pain. But before we leave, any final thoughts and words of advice that you can share with us and patients out there?
I hope again that what I'm telling you all, okay, to sharing with you the common presentation that you need to alert, as I mentioned earlier. So this, when you're able to detect all these kind of common presentation, please come and seek medical therapy. Even if you have a back pain that does not resolve within 1 week, don't really wait until it become chronic. Even though you don't have all the sinister condition that require surgical intervention, but persistent back pain alone without any intervention later on can become a chronic and may lead to you yourself become severely depressed. So always seek the treatment or try to find any opinion so that you have the earlier prevention to prevent all those kind of conditions.
Dr. Carmel, thank you very much for taking your time to be on the show.
You're welcome, Ryan.
Now, I'm Brian Fernandez, and we've been speaking to Dr. Carmel Nizat Ibrahim, the orthopedic surgeon at KPJ Ampang Putri Specialist Hospital, on BizTech's Health and Wellness Show, presented by KPJ Ampang Putri Specialist Hospital. This video and podcast will be on our various social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks a lot for tuning in.